Patients with cancer of unknown primary have a dismal prognosis. The median survival is less than a year. And we now know that the true, genuine biological entity of cancer of unknown primary is hidden into what we call high-risk CUP, which is essentially visceral cancer of unknown primary. So during ESMO 2019, two very important trials have been announced. The GEFCAPI 04 phase 3 trial that evaluated the pick the tissue of origin strategy, and the CUPISCO randomized phase 2 trial that evaluated the pick the target strategy. This is a randomized phase 3 trial, long awaited for by the medical oncology community. So approximately 243 patients with high-risk CUP, cancer of unknown primary, were randomized in this trial into empiric chemotherapy. The regimen was cisplatin gemcitabine versus implementation of a molecular assay that would assign the CUP to a tissue of origin. Then after that, those patients would have what we call tissue of origin tailored therapy. The trial took 6 years to accrue 243 patients. Unfortunately, it was a negative trial because there were no differences in progression-free survival or overall survival between the arm of empiric chemotherapy and the arm of molecular assignment of a tissue of origin and tissue of origin tailored therapy. This is a disappointment. The question to the interpretation of the data is whether the molecular assays failed or whether the therapeutic strategy of treating the patient with a tissue of origin specific therapy failed. Two explanations for that. First of all, our tissue of origin tailored therapies are not as effective as we would like them to be in several tumor types. The second explanation is the fact that using the molecular assays that were used in the trial, we are picking up the similarities between CUP and various metastatic solid tumors, but we are missing the differences between CUP and the typical metastatic solid tumors. And these are the differences that we should be targeting. The CUPISCO is a randomized phase 2 trial. Patients with high-risk cancer of unknown primary are going to be randomized to either empiric cisplatin-based chemotherapy or molecularly guided therapy. By this we mean that their tumor is going to be profiled by a molecular platform, and any potential specific molecular aberration that is identified is going to be targeted by the available targeted therapeutic. So the strategy here is not to identify the tissue of origin, but to identify and pick the target and modulate it therapeutically. The trial is still accruing patients, so this is an exploratory retrospective analysis of approximately 300 patients. The investigators are taking a look at the molecular aberrations that were identified, and they are also providing information on whether those aberrations were targetable or not. The key preliminary findings of this analysis is the fact that 1/3 of CUP patients did harbor molecular aberrations in the tumors that we perceive as actionable, as targetable, and this is very important. Also, 1/5 of those patients may harbor germline mutations in genes that cause cancer predisposition. The key questions to this data are whether the genomic aberrations that we pick up and we think are actionable, whether they are important for tumor biology, whether they are drivers or passengers. Do we get a benefit from targeting those agents, and how do we combine those agents so as to prevent the emergence of acquired resistance? And finally, the most important question in my mind is whether this strategy of picking the targets in the tumor of my patient and therapeutically modulating it with a targeted agent, is it going to improve the outcomes of the patient? So we have to test the clinical utility of this approach, and this can only be done in the context of a randomized phase 2 or 3 trial. So CUPISCO is an important step towards that direction.